Welcome to The Right Tack, where we help private practice owners face the headwinds of the healthcare industry. I'm Paul Jonas, CEO and co-founder of Breezy Billing and Phoenix Credentialing.
And I'm Jim Jonas, therapist, co-founder of Breezy Billing, Phoenix Credentialing, and the Jonas Center.
Today, we're going to talk about starting a private practice in a more historical context.
Oh, wow. Let's dig into this. Well, I'm going to talk about kind of my perspective, and after I Googled a few things.
So I'm going to ask questions.
You're going to ask questions.
It's never officially started a private practice.
You know, and I'll go back to my personal private practice somewhere as we go through this, but I wanted to do a few historical things.
Well, and before we get to that, though,
What?
we got to ask our question.
Oh, yes.
And it really, we always ask, what are you doing this weekend?
Yeah.
But for you and I, it's really often, what are we doing this weekend?
Well, and that counts for this weekend.
That totally counts for this weekend. So what are we doing this weekend, Dad?
Well, son, Saturday's the big day.
All right.
Yeah. You've already brought your power sprayer out to the farm.
Oh, yeah.
So we have this barn party every year, and the loft needs to be cleaned. And this year especially needs to be cleaned because it's got all kinds of bird dew over the floor. And my dear son has volunteered to high pressure spray all of that out of the loft. And it is a dirty job, and I'm going to stay far away from it.
You know, it's dirty, but it's satisfying.
Well, it's going to be
When
really
the job is done, it's a lot of disgusting work. When the job is done, it is a pristine out there.
Oh, yeah, it sure is. So we're doing that. Plus, we're doing apples, aren't we?
Apples on Sunday, yeah. We're going to make some apple cider, I think.
Yeah.
And if we can find time in there, maybe fix the log splitter.
Oh, yeah. We've talked about the log splitter.
No, yes.
We got to take it off.
Hydraulic fluid everywhere.
Oh, it should be good.
So
And your son's going to do some splitting.
yes, with the good log splitter. So we're hoping to have 2 log splitters when this is all
that?
So boy, we have fun this
Wow. I can't wait. So, yeah, that's what we're up to.
So other than that, what are we actually talking about today? So we're talking about starting private practices, and kind of going back in history a little bit about what it used to be like.
Yeah.
And, I know you've got some experience in that. So
A little bit of history.
yeah,
There's a little history. Oh, man. Yeah. Should we do some of this?
let her rip.
Okay. Well, so I did Google this a little bit. So when did insurance start in the U.S.? Well, I thought it was much later than this, but 1929, Blue Cross Blue Shield was first set up. Is that amazing or what? And then in the 50s, employee-sponsored insurances became, started to come into the fold here. And that, between the 50s and the 70s is when my father-in-law, also a clinical social worker, was doing therapy in Waterloo, Iowa, where there's this huge factory. And I remember him talking about, he would, do an, itemized bill, meaning, I performed so many hours of therapy, in this week, send it off to the corporation with whatever, I think he was charging, could have been $90 an hour back then.
And when is this about? 60s?
This is like mid to late 70s and 80s.
Yeah.
Okay, so this is when, he'd send a bill to the corporation and they would send him a check. Pretty easy. Not too much documentation.
No.
How about that?
Different these days.
Yeah, a little different. So that's what was happening then. And then I looked and it's like, anybody remember HMOs? Okay. Wow. What a well, wait, before HMOs came along, I'm going to go back and say 1965, when the Social Security Act came into being, Medicare came into being. So that dates back to 1965.
Okay.
How about that?
So that's getting back there a way.
It is, yeah. Many of you weren't born then.
Some of us were.
Yes. I mean, some of us in this room. Anyhow, then there were HMOs, and so I went through in 1980, 81 to 84. I was working, I was doing a residential treatment program. That was my main job. But my other job was part-time private practice. And that's when HMOs were coming into existence, and what a pain they were. It was designed, quote, for access and prevention of, so people being able to access mental health services and prevent more serious illness. But what turned out happening is restrictions, need for referrals from your primary care doctor, frustrations, and then came along, with the HMO thing, came along capitation.
Okay.
And I remember in the private practice I was working for, we had capitated contracts with different insurance companies. And basically what that means is that the insurance company would pay us for an agreed upon number of people to be covered. So let's say, they had 1,000 people being covered. They would pay us so much an hour for a percentage of that. Let's say 10%. 10% of those people who would access mental health services.
All right.
Well, if we went over that 10%, or we went over that number of sessions, our hourly rate would go down. So they'd write us a check every month for so much money. And that's to cover anybody and everybody who came through on that plan.
So what? So if over the course of a month, you saw somebody for 4 hours in that month, you'd be paid $100 an hour. But if you saw somebody for 8 or 10 or something, they drop that rate down to 75 or something along those lines.
Yeah. So you can never, they give you that monthly rate.
Right.
Okay.
Right.
But then it's up to you. Yeah. If you saw somebody more than, let's say the 4, it would drop your per hour rate.
Okay.
And you couldn't go back and get one. So it was really a deterrent to, like providing mental health services. You wanted to not provide, so you get paid the money and
maximize your rate.
Yeah.
Across your clients.
Yeah.
Okay.
Isn't that something?
Huh.
Yeah.
All right.
That was capitated. I remember doing that a few times.
And so this, okay, keep going. We're kind of setting the table here with the history, right?
Oh, well, I guess so.
Okay. So and we'll get into your experience of like working in private practice a little bit initially, and then some of the different things that you've done in the past year, right?
Yeah. Speaking of billing, how many? Do you all know the HICFA 1500? I used to do those on paper.
Yes.
Print them off and send them into the insurance company snail mail. And if you were off a fraction of an inch in any box with your old fashioned printer, they'd send it back.
And we're talking printer. Does it go back to typewriter or hand? Did you ever handwrite these at all?
I did not handwrite them.
Okay.
I printed them always, but
and it was the HICFA back then. It's turned into the CMS 1500.
Okay.
It's the official professional claim form now. And so anyone who, if you send a claim today, it converts into the CMS 1500 form, which is it's the 8.5 by 11 with the red boxes all over the place. Numbers. We obviously send it all with code typically, but it all translates into this paper form that you're talking about.
Yeah.
And so you would print them off. And have to line up with the old dot matrix printers or whatever.
Yep. And and you get the form, so you'd have the form.
I think it's okay. Wow.
They didn't have to the box. That was a lot of fun. I did that on weekends. The other thing about HMO,
what was I doing on those weekends?
Oh, getting into well, you were too young to get into trouble. Yeah. Just coming and pulling on my leg or something, I suppose. But along with that, prior auths, and again, what a pain those were. And I'm thinking every 3 to 10 sessions, we'd have to do a prior auth with an insurance company rep.
What was that process like?
Oh, and the pain. It was such a pain.
A phone call or a letter?
It was usually a phone call if you got denied. Yeah, you could appeal it by letter and everything, but it would take so much time. Um, and sometimes you wouldn't get. I'm trying to think if you always get a clinician. You might not get a clinician. So it was very painful. And I know that kind of from both ends because after I got laid off from a private practice, I, I got a job with a company where we did authorizations, prior auths.
You reviewed them, right?
Yeah.
Okay.
Yeah. And thank goodness I wasn't an outpatient reviewer. I was specialized in doing residential treatment review. So that was a little more interesting. But again, that's the job that taught me what I love to do.
Oh, how so?
Well, I hated it so much that I realized how much I love doing social work and clinical social work and everything like that. So after 9 months, I got a job with the county of child protection.
All right. Wow. Okay.
Yeah.
A lot of those experiences do.
Oh,
Finding out what you don't want to do can definitely help point you in the direction.
Yes.
What you do if you're not sure. So,
yeah. Oh, for sure.
Yeah.
So, wow. That was a rough year. I got laid off December 18th, 1987.
Okay. And that's from the
3 young
practice.
kids. Yeah.
You're over with? Okay.
Yeah.
Oh, yeah. With all three of us.
All 3 kids and no money. No money. So anyhow, prior auths got scaled back because of negative client care. And can you imagine, you're seeing somebody, you got to call the person to get authorized. They don't authorize it. Now you have to end your therapy with the person, like, well, they didn't authorize me.
Yeah.
Man, it was awful, the messaging. So, and so that disruption, the frustration it caused, and I did see where, the cost it took to administer that, so to have these auditors, was too expensive for the insurance companies. So,
It's less money just to pay.
yeah.
Sounds all right.
Oh, those were tough times. Then I thought, well, shoot, it's been kind of stable since I would say the mid to late 80s, except for things like, once in a while a take back. And I don't know how many people have experienced that.
we could have a whole episode of people talking about their take back.
Oh my gosh.
So, payers just decide, or their fee schedule were wrong in the system, so they were paid by $2.
Oh, yeah.
I could have my billers out here talking about what a pain in the backside.
Oh,
spend hours fixing take backs across the board.
Yeah.
Right. Yeah.
Oh, yeah. So we had one fairly major take back at the Jonas Center, and that was years ago. I hope this is wood.
There you go.
Okay, oh man. However, I'm also thinking, and we can go back to some of my personal experience if you want to, but I'm also thinking of what do we have now? And what I'm experiencing is it's more and more documentation of stuff. So you have credentialing. You need to reattest every 3 months now. You have what else? What do I have here? It's just getting more complex. Oh, credentialing, attesting more frequently, fraud, waste, and abuse training, the HIPAA compliancy training, annual ownership disclosures, more and more specified CEUs. How do you keep that? Okay, did I get a cultural competency CEU? Did I get, a supervision? Anyhow, it's trying to keeping track of all of that. So it gets more and more complicated, which does take more time again.
Yeah.
But
the compliance burden.
Yeah.
And it's death by 1,000 paper cuts a little bit. I mean, really, it's death by 12 paper cuts. So, every year one new thing gets added on there.
Yeah.
Or the regulations change. If you want to be able to keep your,
Right.
made, and if you get given an audit, you're not following the new rules, that can cause some problems.
Yeah. So that's what I was thinking.
Okay.
I did, believe it or not. Years ago, I did the Medicare contracting all by myself
Okay.
through paper.
Okay.
Okay.
Yeah.
So you'd mail in the form you think that she said, the person said that you're supposed to mail in, and then it would come back and it would say, well, this isn't right. You need to change this or that. Took forever. And I would say just as complicated back then as it is now.
Yeah. Well, and the interesting thing with Medicare, and I know a lot of people have had a lot of trouble with Medicare, but I was just saying this on a phone call yesterday, is once you know the rules are fairly well established. Once you know
That's
what the
true.
process is
Yeah.
to do it, but figuring out what that process is,
Oh.
or talking to somebody at Medicare who knows what that process is clearly and will tell you correctly, is very difficult.
Yeah.
And I think I've mentioned this before on the podcast. We always have the rule of 3, both on the billing side and the credentialing side. Call 3 times if it's a real tough question, because you're going to get 3 different answers.
Oh,
and between them all, you'll probably figure out what the right one is, or you'll submit it or whatever, and it'll come back denied. But yeah,
And you're saying call 3
times. You know,
All right.
when I'm fixing the truck, I watch 3 YouTube videos about how to do that thing.
Okay.
And it's the same thing here. You just never know who you're going to get or what they actually know. And
Yeah.
unfortunately, the reps, and it's not their fault. They're not well trained, or new, or there's turnover, and it's hard to get information behind the scenes, even for experts in billing or experts in credentialing and contracting.
Yeah. You know what though? I will say, having someone who knows the system and knows how it works and has done it a few times, like our credentialing company.
Yeah.
It's like, and I'm giving them one for that. It's like,
Well,
okay, they know, what looks right or wrong or that because they've been through it for, how many times. Whereas a new person, it's like, it's learning how to ride a bike. It is a slower process than being able to pay somebody for that.
Well, and Jonas Center was one of our first customers at Phoenix.
Well, yeah.
And you had done the Medicare credentialing, but then you needed to add a bunch of new providers onto your group Medicare enrollment.
Yeah.
And how many hours did you put into that, do you think?
You mean initially?
Yeah, well, the second time.
The second time? Oh, I answered a few questions and that was it. So Stella took care of it.
Okay.
Yeah.
Didn't you? I thought you tried first. Like,
I may have tried a couple of things. Yeah.
Okay. If I go a few hours on the phone and still had
okay. And then still, I would have to call Phoenix and they would tell me what, Stella would tell me what to do. Okay. Do it this way, that way. And it's, it's also not completely smooth because now I just got this, I think it's an attestation again that only I can do. And
so you're required to know your organizational structure, be the person who's responsible.
Yeah.
And then watch out for these things as they come through the mail or email. And sometimes it is only you are the only person who can do it.
Right.
And you have to walk a lot of people through that thing.
Yeah.
But that's going to credentialing. We're going to have an episode on credentialing. That's one of the last pieces in the larger series that we're doing about starting a private practice. But let's get back to starting private practices.
Yeah.
I'm going to pull it back a little bit because I know, so you had that experience in private practice just as a provider as part of the group in the 80s, right?
Right.
And then you started your own practice. And I know we still have your, in one of the sheds at the farm, original
cigar bar lounge.
We do have a cigar now and again in the wintertime. But in one of the sheds, that chair from your original practice in the 80s, like could have come out of Beetlejuice.
Stripes.
It's got the black and white, or black and gray and white
stripes. Yeah. I'm not sure. I think I'd go a little crazy. My eyes would start bugging out after a while. But that is still there.
That's the original chair.
That's
your
the
original
office chair.
Jonas, LICSW, LMFT, or whatever it was.
Yeah. And that was actually a used chair from Court Furniture.
Get out of here.
I had no money back then. Children were expensive.
Oh my gosh. Well, that's what, yeah. That looks Ellis burdens.
Yeah, financial burdens. Oh man, yeah. No, that was it. Yeah. So the scary part, too, I like starting a private practice. It's like I'm trying to remember if I contracted with insurance companies. I did the Medicare thing, but or if you just sent them some bills again of the 1500s. I don't remember that. I remember the scariest part be renting an office.
Oh, yeah.
Furniture.
Okay. Well, we covered that in, I don't know what episode number that was.
Yeah. Yeah.
Okay.
So
Cool. But what was so scary about that for you?
making that commitment to sign a lease and not knowing if you were going to get clients, are they going to come?
Yeah.
It was like, oh my gosh, and just, that initial, will people come, if you build it.
Yeah.
And they did, which was good. I'll say I did. I worked part-time. I worked part-time private practice for years while I had, a day job. So I had a part-time situation going. So that buffered, the change a little bit for me, but it was still scary. Yeah.
So then how long were you in that private practice?
Oh, well, until we started the Jonas Center, which was 2005.
Okay.
So it was just James Jonas, LICSW, LMFT.
Okay.
Oh, and by the way, so back in the 80s, whenever it was that they started the licensure thing.
You're dual LICSW, LMFT.
Yeah. I got dual well, okay. So I was a supervisor, and back then, in order to become licensed, and I think a supervisor, I just had to have so many years of experience. I didn't have to take a test or anything. They just grandfathered me in.
And which one? So what?
Both.
Really?
Yeah.
Okay.
I came with
Wait, so licensure was a new thing?
Yes.
Oh, wow.
Licensure was 80.
It's a whole nother episode we can talk about the history of licensure.
Yeah. Early 80s, I want to say.
Yeah.
85. Late 80s. Yeah.
Okay.
It's yeah. So when I came to the state of Minnesota, I had in social work lingo, I had my ACSW, which was kind of equivalent to a license. It was 2 years post, Academy of Certified Social Workers, and pay a little extra, and that meant that you had at least 2 years of experience after your master's degree.
And so through that, when the licensures came through at this state, or that across the country?
Well, at this state,
okay.
This is what I know.
So then you're able to get licensed as an LICSW and an LMFT with the 2 years of experience.
Yeah.
A little different now.
Yeah, it sure is. Yeah, that was some history, but yeah.
So what? And I remember, as a kid, you'd be working like 3 nights a week in your private practice, and you had your
day job, and at least 2 nights a week, sometimes 3. Yeah.
Okay. And so what was it that led you to starting the Jonas Center? Or what was that initial, like, I want to do something bigger or different?
Yeah.
To decide that I'd really start a group practice.
I think I always wanted to have a group practice. And part of this is, for me personally, if I were to do therapy full time, I would become, unhappy about it. Okay. I get burned out. So I need a little variety. And some people think I'm crazy for this, but I kind of like the administrative stuff for the most part.
Okay.
And so I always wanted to, get a private practice, a group practice. And I had an opportunity, years ago, when we first just moved into the Cologne office. I think I was supervising somebody who said, well, my boss is selling their, practice in Glencoe. I said, well, I might be interested.
Okay.
And that's basically how it started. I went out there and made a deal, and that was the beginning of the group practice.
Okay. So that was the sort of the Jonas Center was.
Yeah.
It was through somebody you were supervising.
Yeah.
Their group.
Their employee.
Okay.
Yeah. He was retiring.
Okay.
So, yeah, so I talked to them and I think we started with 3 therapists. Yeah.
Awesome.
Yeah.
And so then what did you do what'd you do first? Like once the Jonas Center was started, how did you and Mom, because you guys went into this together, right?
Gosh, I don't think she had her degree yet. Well, wait, she was working on her.
Okay.
we had a basement office in Waconia.
Okay.
I don't know if you remember that.
No.
Okay.
No.
But that's where we started the 3 of it, and her dad. So it was the 3 of us who got that going.
I do remember that. That was by like a Pilates studio or something.
Well, the chiropractor upstairs.
Something like, yeah. Okay. Yeah.
Yeah. So, yeah, it was pretty dark. But it was a start. And then having this opportunity in Cologne, actually, we bought the little building and remodeled it for a year.
Mm-hmm.
With
I remember that. Yeah. A lot of work on that.
Plans out of huggable. So, yeah. And your friends helped destroy did the
yeah, we did the demo.
Yeah. A couple buddies. Yeah, that was good. Yeah, so we did that, and changing all the numbers and everything and the name to keep the contracts that the old original owner had. It just went through all that, and you get through it. You just got to be patient, breathe deeply, and do a little meditation.
One small step at a time.
Right.
Yeah. So how'd you grow that? Could you talk a little bit about, if you knew you wanted to start the group practice, you got the Jonas Center, you got the contracts shifted so that everything was in the right name and nice tax ID probably too.
Yeah.
Which, we know that process fairly well on our side. But like, what were your plans or hopes and just walk through kind of some of that. How'd you manage it or administer the Jonas, I guess, from there?
Gosh, well, part of it was kind of a slow, once I got the Jonas Center in Glencoe and then we had the Cologne office, I also had a Burnsville office.
Mm-hmm.
And people I knew, would say, I might approach them and say, hey, would you like to do a little part-time practice? And, I got a few people interested in that. And then the famous one is our clinical director now, Christine, who I had hired at my day job years before that, who had been a student with my wife at the St. Mary's doing the postgrad thing. Lisa told me that, I had to hire this person. So Christine interviewed for me at my day job. I hired her, and then at some point, paths crossed again, and Christine and I had lunch or something, and she said, Jim, if you rented an office space in Eden Prairie, I'd come and work for you.
Oh.
And that's how that came about.
Prairie location, where we're sitting right now. The great windowless headquarters.
Exactly.
All the therapy offices do have windows.
Yeah, Christine's got the biggest office.
She does. Yeah. Puts up a lot. Put up with us.
Well, she does. So, anyhow, yeah, so that happened. Another therapist wanted to try Del Plain. Where else? We had a Wayzata office for a little while. Yeah. So,
well, then what? COVID hit. Wasn't that part of the deal? I know we've opened and closed a few offices, kind of dependent on the providers there. But once COVID hit, we had to consolidate.
Yeah, at one point I had 6 locations, and then COVID hit. Well, basically COVID hit. I had already decided to quit seeing people in Burnsville. So that lease was up, which was great. But then the Belle Plaine lease came up and we did renew that. And we ended up here then with the 3 office spaces we have right now and telehealth. And I don't, you probably remember shifting from in-person to telehealth.
Oh yeah.
Almost overnight.
I'm not that young.
Okay.
We helped a lot of people survive that.
Oh yeah. That was amazing. And then, this is wild. I was thinking about this morning. It's like, when we were all, stay at home, I would come to each office to, get the mail and that kind of thing. And there was nobody here. It was empty, quiet. Whereas it had been buzzing before.
Right.
There were people all over. We were busy in all 3 sites. Then it just dropped to nothing. And I thank goodness for telehealth and, people being able to shift to that. And,
the insurance companies
The insurance
shifted pretty
companies.
quickly. Gotta
Yeah.
give them props for
Yeah,
that
I
too.
do. That was either.
Yeah, I remember. So you and I were on NPR when
That's right.
with that. So we got interviewed by one of the local reporters, but it got picked up by
Got it.
is that Marketplace?
Marketplace.
Irisdall.
There.
So we were one of the sub stories on that. Just talking about how mental health providers don't know if they're going to get paid, but they're going to keep seeing clients as they shifted to telehealth almost immediately.
Oh, yeah.
So that was an interesting time. Yeah, I think Breezy was fortunate that we were already set up for remote, so we were able to focus on helping our customers through that one. Yeah, and helping you guys, figure all that out. It was all in person. 98% in person. Switched to 0.
Yeah.
And now, what'd you say your mix of telehealth is, by the way?
Oh,
In person at the Jonas Center.
well, I've got two therapists who just do telehealth. They're part-time, but that's all they do still. And then the rest of us are hybrid. I don't know if it's 50-50. I think it's probably close, or maybe a little bit more in person now.
Okay.
And it seems to be going in that direction. Some people that I see just really prefer telehealth, and some people, don't want it at all. We were talking about, that shift when COVID hit, just to exclusive telehealth.
Yeah.
And then I'll tell you, the last 6 months or so, the in-person has picked up. I'm seeing people in the offices.
Yeah.
And I'm seeing clients in waiting room, in the waiting rooms. And yesterday we were here and it almost was like a party.
Yeah.
And with, my client was here and he was going, oh, wow, this is great. And, there were,
Yeah, quite a few people out waiting.
yeah. And it was like, oh, this is good. It's
Yeah.
really good.
Yeah, it did. It was good. It was a good vibe. Just movement,
Yeah.
liveliness.
Yeah.
People being around.
Yeah.
I noticed that too.
You did.
Yeah. Okay. Our meeting yesterday. Can I take you back a little bit? I think one of the things that a lot of providers who are thinking about starting a practice but are hesitating is they don't know if they're going to be able to figure out when something goes wrong or when there are problems. So do you have any examples of administrative headwinds or things that happened that were scary but you survived? And because you never know what's going to happen. It's kind of like when you're talking about not knowing if you'd be able to cover rent.
Yeah.
But you were. Yeah. So were there any other things that happened in the past that if I were thinking about starting a practice, I might be scared of it, not knowing that I could deal with it, that you dealt with and were able to overcome?
Yeah. Oh, I have a few thoughts. As an owner, there's risks. And you got to be able to live with that. Early on, we were audited. The provider tax had just started, and we were audited for the provider tax. And I mean, 2 people came off with 3 days going through all of our financials, and I was like, "Oh my gosh,
Wow,
what is happening here?" And we had our records in, I would say, really good shape. And, it was like, what's going to be the result? And the result was that we got to pay them a little bit. And they figured, well, that was because they had to drive all the way to Glencoe and get paid for their time.
Gas and lunch.
Yeah. So that was good. So, really, I guess anything I would say, if you have, I may quote this a little bit here too. There's this kind of gray area where you need to take some educated risks, but you don't want to take too many risks. So, so I'm on like the provider tax. I'm on top of that, and we get it down to the dollar at the end of the year with the estimated payments for that. The other thing would be being reported to the board or having a staff member reported to the board. That's scary. And just walking through that, I mean, I've learned how to do documentation, and really, I'll knock on wood again. We've had one, maybe three different, over like 20 years, three different reports to the board and numerous therapists. So I feel like that's a pretty good track record. But walking people through that process, and just documenting, and it takes time, and you just have to put your nose to the grindstone and take the time to do it. The insurance take back, I'm remembering correctly, I think I argued with them on some points, and got that take back decreased.
Okay.
So
So you had, like, you survived it all, though.
Yeah, survived it. And, gosh, I gotta say, it really did provide a pretty good living for us. It was, you're not going to get really rich, but it does provide for you.
You guys have fun.
Well, we do. Okay, we just bought a side by side.
What are we doing this weekend?
We're right side by side. It's for Lisa's birthday. But yeah, that's fun. Yeah, and we do. This is a really good time of my life, and part of the good thing about private practice too is that you can set your own schedule. And for us at the Jonas Center, we really try and encourage independence with the support in the background, so that we're not going to mess with your schedule. We've got, if you need a referral, get a hold of our office manager. She'll make sure you get a referral, and then it's you're the one in charge of that. And that's the way I've kind of always tried to manage agencies that I've worked for, and the Jonas Center, which is get out of the way as an administrator. And if someone needs you, then be there to support them.
Just kind of always ready to step in.
Yeah.
If needed.
Yeah.
Not to be standing in the way.
Yeah.
Okay.
Yeah. So,
and that's, and that's one of the things, because with more freedom comes more risk, is what I hear you saying. And just couldn't agree more. And sort of these businesses too, and working together on those. But with any, when you're in charge, the buck stops with you.
Yeah.
But at the same time, there are so many resources some you might not think of. I think of any provider who were to start with us. Well, and shoot, I've even referred customers of ours to chat with you about starting practices, about what they should do next or some things.
Yeah.
And so, if you're thinking about starting a practice and you have hesitations, reach out here. We can hook you up with, other customers that are more than willing to chat. I would definitely cross-refer between new customers and existing customers. Everyone here is here to help support anyone who wants to start a new practice or to grow a practice they have.
You and I are both like independent. We like our independence.
True. Yeah.
And that is the beauty of this. It's you are your own boss, and it's independent. And I work best that way. I'll just say that. Yeah.
All right.
Wow.
Anything else? Anything else the people
God,
should know?
I'll get back to independence and as an administrator, have good guidelines, but then get out of the way. And really try to live that way. And you do, younger people too. I think they're more used to all these, the new and different requirements that keep coming in.
Mm-hmm.
Just staying on top of that, gotta get through that.
Gotta read those emails.
Gotta read the emails. Yeah. So, yeah. Great.
Right. Well, I guess that's it for this episode. But before we conclude, we always like to ask, what are you thinking about? So lately, what have you been thinking about? So side by side.
Well, geez, there's so many. But one of the things is what we mentioned before about just people coming back into the office and how good that feels. The other thing is my youngest is getting married 2 Saturdays from now. And that's keeping me pretty busy. It's keeping all of us busy. Yeah. So we're thoroughly enjoying the prep time for that. So she's going to get married at the place. We're doing some cool stuff that way.
Cool.
Yeah. What are you thinking about, Big Dad?
Well, I've been thinking about consultants.
Oh,
especially this week. So Breezy's brought on different consultants in some different roles to assist us. And I also know of therapists who've done that with their own practices. But for us to have these fractional consultants, whether it's in the financial role or the marketing role or the tech role, it has really helped Breezy get to where it is today, which is a pretty dang good place, and really set the stage for a brighter future that we had hoped for. So it's just been it's been expensive, very expensive.
Yeah,
but I would say worth it.
It's worth every dime
for our guys, and it's hard to find good ones too. We had to kiss some frogs before we those guys knew we were about to go.
Oh my goodness,
find these princes. You guys know who you are. We'll happily make a referral if anybody wants to know.
Right.
But they've having professionals who've been through this stuff before really has helped us out. And I know that there are people who are available to do that for you. That's part of what we're trying to do here with this podcast. So it's always worth just talking to someone, even if you don't know and get anything out of it. Just asking the questions, and you never know what conversation you're going to have, especially if you're stressed or nervous or anxious about what's going on.
That's true.
With your business or your practice.
Well, and these consultants, I'm going to go a step further and just say they're people we trust.
Yeah.
And that, boy, when you have people that you feel are in your pocket, that are behind you, that you can trust, it really does make a heck of a lot of difference. And that's where it's worth the money.
Yeah.
I got to say that.
Yeah. It's like walking into the club with a posse,
Yeah.
You can start a little bit bigger.
Well, saloon, is that what we're
Sure. Yeah. Any place. So I got a group of people, you can do whatever you want.
Oh, shoot.
Makes you feel a little more in charge or in control. Of whatever you're getting into or trying to get to.
Yeah. Reassurance that you're on track, or maybe you need
to make sure that you're crazy. Yeah.
So,
so that's what I've been pretty cool lately. All right. Well, that's it for this episode of The Right Tack. Make sure to follow us wherever you get your podcasts.
Well, and if you like what you're hearing, share it with your friends and colleagues. That'd be great.
And until next time, I'm Paul Jonas.
And I'm Jim Jonas.
Keep your eyes on the horizon.